Again, we'll move straight into Dr. Noel Tiano, who has had amazing roles in chaplaincy, in social work, and in ethics management as well. So, welcome.
Tēnā koutou katoa. Thank you very much. I'll be talking about spiritual assessment using clients' narratives. And this morning we were introduced to some of the body of literature that's emerging. We're not there yet, but hopefully in a few years' time we'd have a more evidence-based studies and research with regard to quantitative and qualitative studies. We were introduced to the indigenous assessment models with the Whare Tapa Mahia Atua and the Fono Fale Pasifika health model. Some of the spiritual assessment tools that are used particularly in the US might include the FICA by Dr. Bukowski and others, FICA, and the other is HOPE, H-O-P-E. The spiritual assessment tool that we use at the mental health unit in Porirua is very simple. I use a page of paper with the question, if you were to describe your spiritual journey using the space below, what would that look like? And people could draw, write, use metaphors, symbols, and others. And these are just snapshots of where they might be at that time. Someone said, I'm stuck in a daydream that keeps repeating. Someone said, I'm cursed by the devil. And another said, I feel like a bamboo because I'm resilient. And another said, I'm like the coconut tree because I'm being productive at this time. So some of the guide questions that we include would be, do they have a religious upbringing? And how might that affect their stay in the hospital? Favorite image of spirit, higher power, or God? Where do you go for inspiration? Some experienced detours in their faith journey. How have they handled those detours? And what beliefs and practices are important for your care while in hospital? What do you think caused your illness? Any concerns, any fears? What do you need to do? So in narrative literature, we have them try to identify the dominant themes and how they can participate in writing their own stories. And how can I assist in their journey? So I'll be presenting 5 cases at MAGE, 2 females, 3 males, 2 Maori, 2 Pasifika, 1 European, in their 20s to 40s, and all of them are from forensic mental health. I've recreated their sketches in the following slides. So that's Mary. And one time Mary told me a story that she was really drunk and intoxicated with some drugs, and she was driving around in circles, couldn't find her way back. So she sees this house, stops, knocks at the door. An old man came out, and she asked for directions, and she said, I'm lost. I need to go to this place. So this man gives her instructions, and sure enough, she was able to find her way back. And she said, it's kind of like the experience I'm having here in the hospital. And I responded, hopefully together we can help you find your way back to where you want to go. So her background, early 30s, had PTSD, physical and sexual abuse. She overdosed. Her turning point was that she got lost and needed help. Her inspiration for her recovery was her mother. She was there when she overdosed. And her teenage daughter. She wanted to have custody of her daughter again. She had faith in God. She wrote poems, beautiful prayers, and recorded a gospel song with another client. And this one's Leah. Her image was a rose plant. 20-year-old sexually assaulted by a relative. There was a court case. Her turning point was that she had a grief work, and it was a very difficult time. But we had a memorial for baby, and she planted a rose flower, released a balloon. And I thought that after that, she attended more of the chapel services, did spiritual reflections. She loved volleyball, cultural programs. Less than a year, she was discharged from hospital, and she planned to become a cook. That's my recreation of a phoenix for Mark. Late 20s, he had a homicide case. His turning point was that he approached me and said, "Noel, I'd like to be baptized." And I said, "I'm not representing any church." He said, "I just want the ritual." And as Jesus, during his baptism, there was a dove, in his case, a phoenix rising from the ashes. And sure enough, I presented him with a certificate of baptism, and I put a symbol of a phoenix. And we talked about, how's the phoenix doing these days? He attended chapel, requested prayer and communion, Maori cultural programs, walking group, choir, and enrolled in a wananga. And that's a taro leaf for Luke, representing his connectedness with his people, with his family, his country of origin, and his practice. 30s, alcohol and drug abuse, court case, he had sexual assault charge. And his taro leaf was not just a drawing, he had huge artwork of taros. And many of these artwork by other clients were also displayed at Pasifika Museum on 2 different occasions. Very inspirational. Mom and Dad came from the islands to support him. He had a son, and that was his inspiration for well-being. Attended cultural programs, communion chapel, drumming, participated in drug and alcohol recovery, violence prevention programs. Next one is a tablet. I forgot to mention, not this kind of a tablet, but more of that tablet, and that's my recreation of a tablet. So here's John, 40s, arson, suicidal. He viewed God as a judge, and Moses was the lawgiver, hence the tablet. He didn't like Jesus because Jesus talked about forgiving one's enemies, and he said, "That's too much for me. I like it more cut and dry." Moses, tablet, commandments. After about a year of working with him, he started to demonstrate an awareness of his behavior and consequences of his action, which I might call pre-contemplative insight. And then he started participating in programs, walking group, volunteering at chapel. He showed signs of being reflective. He interacted with others and expressed humor. The WHO spiritual care intervention codings, used particularly by La Trobe in Australia, identifies 5 of these interventions and their codings: assessment, counseling, guidance, or education, support, ritual, and allied health intervention, spiritual care, such as if one of the staff would say a prayer or bless the room. So if I were to write up a spiritual assessment, I'd summarize it on the progress notes, and on a page, it might look something like this. The upper part would include the introduction, and under spiritual assessment, that might include the indigenous models. I usually highlight the meaning of illness in the light of their faith tradition. How do they understand the cause and purpose of the disease? And with John, our last case, he kind of looked at his situation as more of a punishment. And I wasn't there to take away how he interpreted his illness in the light of his faith. He saw that punishment was part of his rehabilitation. But I tried working with him so that I'd include topics like forgiveness and grace. At some point, he didn't want to talk about that. Under ritual, he liked prayer, prayer book, scripture, music. And under spiritual support, he'd identify fear. After about a year, then he started loosening up. And that was where forgiveness came into being in the forefront. Education, we used serenity prayer a lot, that there were things outside of his control, there were things within his control, and we talked about what were those things that were within his control. Conclusions, this tool will be useful for clients who have the capacity to engage reflectively. Mental health, mental status more stable, positive religious coping. Limitations might be that some clients may dislike drawings or symbols or metaphors. The strengths are that they can use their own stories and frame it in their own themes, non-linear. And it's helpful to summarize the spiritual assessment and intervention on patient notes, MDTs, SPRs, and staff referrals. And lastly, I kind of look at hospital chaplains or spiritual carers as part of the allied health team instead of contractual staff coming in from the outside. And that's it. Any questions?
Wonderful. The speakers are making my life very easy. I haven't had to use my stop now sign. Questions? Yes.
Thank you very much, Noel. I'm Bridget Tamoipia, a retired psychiatrist. How well accepted has that kind of documentation and assessment been with the clinical staff?
Over at CCDHB at MAIDS, very well, especially since both of the spiritual carers are now employed by the DHB. And so it's not just a special staff status that they enjoy, but they're actually a part of the staff. And so they have access to notes, attend MDTs, special patient reviews, and the like. I understand that other DHBs are different and may not even allow some of the spiritual carers to have access to the list of patients. So, yeah.
I'm Trish McBride, formerly mental health chaplain.
Hello, Trish.
How do you attend to patients who believe that their illness is demonic possession?
Right. Well, we start with where they are. Instead of saying, that's really too far left field or minimizing or maximizing, then we'll just start with where they are and walk alongside with them. Conversely, with some people who say, I am God, or I am an angel, or I'm Jesus, I might say, how is Jesus today? And then just gradually work with them, engage them in their stories, and when they are able to, then we could do more of the work.
Chris Malcolm from Napier, from EIT there. From what you're saying, the spiritual carers or the chaplains seem to do this spiritual assessment as a kind of standalone piece. Is there any movement to have regular health professionals incorporated into the rest of their assessment that they do? And if so, how do they pick that up? What's the training or the upskilling they need to be able to do that?
So I'm just trying to understand, is your question like how would other staff be able to incorporate their...
Is this becoming, if you like, mainstream, or is it a specialty thing that you have to do separately?
Like for chaplains within the CCDHB in mental health in MAIDS in Pororua, they are a part of the whole interdisciplinary team.
What I was thinking more was, somebody's out in the field, they do a mental health assessment.
Yeah.
They also look at physical health, they look at family health, but they don't look at spiritual health. How can they pick up the spiritual health dimension as well in the assessment that they're doing,
right,
rather than having to pull you in separately?
Right. I guess it depends on their level of comfort, if they are able to incorporate some of those. I mean, I'm a social worker as well, so if there are relevant spiritual topics that would be important to incorporate in my social work assessment, I would include that, as well as to make it a referral to the spiritual care as if needed. I mean, if they give me consent to do that. Yeah. Well, and if with a WHO, the fifth one is the Allied Health Intervention Spiritual Care, which is one of the codes that they can use. Yeah. Yes.
Thank you, Noel, and thank you for that question.
Richard.
I'd like to follow up on that question with a comment. So what we're trying to advocate for is a generalist and a specialist approach to spiritual care, where the generalist approach is all healthcare professionals who can do a basic spiritual history, and then we have specialists, which are like Noel, who can do the spiritual assessment and spiritual care plan. That doesn't happen in New Zealand at the moment across the board, but that's part of what we're hoping to advocate for.
Yeah, which was part of the study by Dr. Pukalski and others.
Tēnā koe, I'm Jan from a kaupapa Māori mental health service. I'm a registered nurse, Māori registered nurse. I just wonder, when you do the assessment, do you develop it to the individual, or is that just a straightforward assessment that fits for all?
To the individual.
To the individual?
Yeah,
and would you bring in external services to support that?
Absolutely, because I view spiritual care working in close working relationships with all the services. I mean, we work closely with Maori Cultural Services, Ruamoko, and as well as with the Pasifika, Vakaoli, Pasifika, and other interventions.
And I didn't see much of the whanau involvement because it always comes back to the whanau as well.
Right.
Was the whanau
That's true.
involved
That's true.
throughout the process?
Yes, in one of my limitations with just the 5 case studies was that I wasn't able to include all of the other interactions that we have had with the whanau, but definitely yes.
I think you're doing some good mahi, but also be mindful of te ao Māori and those Māori beliefs as well, and bringing it back to our atua and seeing whether that is what their beliefs are rather than a Catholic baptism type thing.
Right.
So you do incorporate that as well?
Yeah, and if I'm not able to, then we make sure that we refer with Maori services so that they would know, because that's all part of the MDTs and staff meetings and referrals. Yeah.
Kia ora, wonderful. Thank you, Noel, and thank you everybody for your questions and contributions.